The hospitalization surges with RSV is certainly concerning. So, is there a way to treat this before it gets to the point of going to the hospital?
So RSV can be treated at home, just as you would treat other cold symptoms with cold medications, fever reducing, hydration. But if it's a child with breathing problems, that really is something that needs to be addressed in a hospital. Obviously, if a child is sick, we recommend that they not go to school or daycare or preschool to infect other children. So reducing the spread, just as with any other virus, will protect other children from getting sick as well. But there's no antibiotic that will help treat RSV. It's really just treating the symptoms as they come.
And how do you reduce the risk of spread of these illnesses?
So reducing risk of any sort of infectious disease is pretty similar across the board. Hand washing, staying home if you're sick, not exposing other people to an illness that you have or your family has, and masking. Certainly, indoor masking in large crowds in winter seasons is something to be strongly considered. That does protect the person wearing the mask. It does protect the people around them. So while masks are not mandated, while masks are not mandated, it is still something to strongly consider when you're in large crowds this winter season.
So, let's say you contract one of these illnesses that comprise of the tripledemic. How long are you down for the count for each?
So on an RSV infection, an uncomplicated RSV infection can be 3 to 5 days, can be pretty short, just like a cold. And most people who have RSV, whether it's a child, an infant, or an adult, they don't even know they had it because it just seems like a regular cold. A lot of doctors don't even recommend testing for RSV because that's not going to change the management. If your child has RSV, you treat the symptoms. If they're sick, you come into the hospital. But again, most RSV infections just last a few days, certainly under a week. A flu infection can last about a week, sometimes 5 to 7 days of feeling really, really under the weather, high fever, body aches, weakness, fatigue, sore throat. And COVID, as we know, can last anywhere from 2 days, can be asymptomatic, and it can last months. That's the big unknown virus still, is that there's so much variability on how people respond to the illness.
And how long do you think that this tripledemic is going to last?
So we really don't know how long this tripledemic will last. Some data have shown that the new hospitalizations for RSV may have peaked. That doesn't mean that the hospital beds are open, because kids who are hospitalized for RSV may be there for anywhere from 4 days to several weeks. But if the new hospitalizations have peaked for RSV, we may start to see a decline in hospitalizations, and then hopefully the season will end sooner than typical. The flu is also peaking early. Typically, the flu peaks in January, February in many states, even later in some of the southern states. If that's peaking earlier, it may end earlier. COVID, we don't really know. We can't really say that there's a season anymore because we've had summer surges, spring surges, winter surges, fall surges. So COVID, we don't really know, but hopefully this tripledemic will end sooner rather than later. All we can do is hope and that keep everybody healthy. There are vaccines for COVID, there are vaccines for flu out there, and ways to protect against RSV is really just basic ways that we would protect against any other infectious disease.
Dr. Nina Shapiro, thank you so much.
Thank you.